Hi, Anne. Welcome to our podcast. We are so happy to have you here on our Big Unlock podcast, season six. And we're headed to, 180 plus episodes now. So, really great having you on the show today. And just wanted to give a brief introduction. My name is Ritu M. Oberoi. I'm the managing partner here at Big Rio Demo Consulting and a co host of the Big Unlock podcast with Rohit. And with that, I'll hand it over to Rohit. He can give a brief introduction and then over to you, Anne. Thank you.
Yeah, hi, Jan. Great to have you here, like Ritu said, and thank you for making the time in the evening, from where you are at in Germany. So really excited to have this conversation. I'm Rohit Mahajan. I'm the CEO and managing partner at Big Rio and Demo Consulting. And with that, Jan, would you like to start with your intros?
Absolutely. First of all, thank you very much both for having me today, for the invitation. Truly appreciate, and looking forward to a good conversation about this exciting topic of artificial intelligence in healthcare. As you just mentioned, my name is Jan Beger, Head of AI Advocacy at GE Healthcare. And look, my mission is to transform AI in healthcare from a, let me call it, conceptual promise into a high impact reality. And doing this, I focus on really trying to equip healthcare professionals, healthcare executives, but also the next generation, like students, with the knowledge, the skills, and the mindset to thrive in this AI-enabled future of healthcare.
That's
Great,
great.
wonderful
Yeah.
introduction.
Yeah.
Yeah. And really interesting title you have, Jan, because we've talked to CIOs, CMIOs, but talking to somebody who's the head of AI advocacy, I think that's really something new. So, would love to hear about how your journey and how you came to be in this role and how you combine expertise in healthcare and AI, and what do you see your vision for AI is at GE Healthcare?
Yeah, thank you so much. I mean, look, first of all, and I think I hope you agree. I believe you agree, right? Based on the many conversations you had in this space with different people, different experts. When we talk about AI in healthcare, those conversations very quickly get very technical, right?
Mm-hmm.
But I think in healthcare, and maybe we as an entire industry, if you will, as an entire ecosystem, I believe we have not focused enough on one important aspect, and this is making sure that those people, those clinicians, those healthcare professionals we expect to use AI technologies, that we take them with us on this technology journey.
Mm-hmm.
Yeah. So things like change management, education, yeah, making sure we focus on the human aspect is something I think that has not been focused enough across the industry, and maybe even to a point that it slows down AI adoption, right? And this is what I'm really focusing on, right? What do we need to do to make sure we remove all those worries and fears among healthcare professionals and get them to a point where they have a solid understanding of the technology, a basic understanding, where they get an initial level of trust in artificial intelligence and are really interested in testing, piloting those solutions, and ultimately the idea is this could lead to a kind of faster adoption.
Yeah, that's an extremely valid point, Jan, because I was just at a conference at MIT yesterday, and this was one of the key, things that came up that it can't be a top-down diktat because whenever you are asked somebody to do something, their initial thing is to go into defensive mode and say, why should I do something that's going to take my job away or, you know, what's in it for me? So we would be
Right.
really interested in hearing from you how you are able to, get buy-in from the teams across GE and able to kind of get everybody on board and make sure everybody has the literacy skills, like you said, to understand that, AI can actually be a tool for you to do your job better and make things better and, increase productivity and all bring efficiency and do all the good things that we've been seeing, AI promise to everybody.
Right. I mean, first of all, I think right across different domains and industries in
Mhm.
a health system, but the same in a med tech company, in a health tech company, right? Everything is kind of reinvented right now in real time using
Yes.
all kind of roles, all kind of processes. So there's a lot of activity in that space, and we at G Healthcare, of course, also look into processes, procedures, and how we can support our workforce with things like generative AI technologies. Yeah, and I mean, again, also here, the technology is one part of the story. The second is how do we make sure we enable our workforce, 51,000 employees across the globe in 160 countries, to really leverage this technology well, responsibly, to truly make a difference in their day-to-day work. Yeah, and this is exactly the same in the healthcare system space as well. And look, I think we can all agree that we enter a decade of skilled redefinition in real time. Let me say it like this. Yeah. So there are things that have been important in the past which are becoming less and less relevant. I think about things like routine execution or static expertise or hierarchical knowledge. Those are kind of skills or capabilities which seem to kind of fade out or become less relevant. And on the flip side, we see really more important skills emerging and growing, things like adaptability, systems thinking, tech fluency or literacy, AI know-how, those kind of things. And I think we all have to prepare for this. And actually, just there was a study recently done by Workday and LinkedIn, which said that 70% of job skills are expected to change by 2030. Yeah, with AI driving much of this shift. And this is not just healthcare, this is across different industries, right? And maybe in the healthcare domain, this kind of change will feel a little bit slower or even come slower, really, because it's, as we all know, it's highly regulated. But what I want to say by mentioning this number of 70% is that there is a massive technology transformation ahead of us, and a lot of people not even understand that this is coming and right to quite some extent, with quite some impact. And I think we all need to not just continue working, building great technologies and integrating those great AI technologies into great products and workflows and so on, but we also need to make sure we create awareness, build AI literacy, to the point that we all enable ourselves right across the healthcare ecosystem to use this technology responsibly for better care and for improved patient outcomes at the end.
Thank you, Jan. That that answer leads into two follow-up questions, which the first is that, like you said, the speed of invention, which is really at an unprecedented scale, which we haven't seen before. So, and the speed is also leading to a lot of democratization, where we are seeing anybody can do vibe coding or build a tool or a prototype. So, and that leads to the next thing, which is this whole concept of AI literacy, that if the tools are so easy to use and can unlock so many new ideas, then you want everybody across the company to be able to understand how to use them and to be fluent. So how does GE, with such a large employee base, like you said, 51,000 employees across 161 countries, do you have like a overall AI literacy program that people can go through with different levels, or what are the kind of systems that you're setting in place to address these questions?
Great question. Look, first of all, I should define what AI literacy means to me, right?
Yes.
Because it could mean a lot of different things for different people. But in a nutshell, I would say it's kind of three things. One is to like the competencies to or required to collaborate responsibly with AI, yeah, to interact with this technology, such as large language models, generative AI. The second is to be able to explain their outputs. Yeah. And third, I would say it's really to be able to critically evaluate those outputs. Yeah, and then to do something meaningful with them. As you know very well, the worst thing would be to kind of blindly trust those outputs and leverage them in your day-to-day work. So critical evaluation, I think, is a very important part of AI literacy overall. And look, I mean, at G Healthcare, there is AI literacy program in place, which is part of a broader what we call responsible AI strategy. We have different ways to educate our teams through like live sessions where they can dial in and learn right from some of the experts in how to use generative AI technologies integrated in our tech stack. Best practice sharing sessions. This is something else we have. We have self-paced learning offerings for our employees for at different levels, from a foundational course where they just learn about like the basic terminology used in AI, which is very often very technical, and then to like more kind of use case specific, more in-depth trainings for specific groups of employees, different roles.
Mhm. Rohit, would you like to ask a
Yeah,
question?
I was just wondering. I was thinking, Jan, about this key initiatives that you're taking, which are so valuable. I think moving forward to the company and also to the employees themselves, because they're basically increasing their skill sets as well, right? So, uh, we've been also thinking about some success metrics, like for our own organization as well, and for some of our clients who have been asking for similar services from us. So, any thoughts or ideas, Jan, on what are the success metrics that one could track for such initiatives in any organization that's setting on this journey?
Yeah. I think those kind of success metrics, KPIs, are critically important to just kind of measure traction and see where you're heading to, and if all the investment you make into those efforts really kind of makes sense. Um, and look, I mean, for instance, one of the things where we have seen like early positive results is on the side of our software developers. Yeah, so with the support of AI capabilities, we have seen quite some kind of improvements in terms of speed, right? To get the code done, get the code reviewed, those kind of things. So this is maybe one area where I think across industries, we already have quite a couple of kind of industry best practice or industry standard ways to measure like performance and overall progress. But then there are other kind of groups of employees, if you will, where maybe those kind of measures are a bit harder to obtain, or maybe it's too early to do this right now because we just have started with those kind of capabilities. For instance, right when I think about our technical experts. Yeah, so for instance, our so-called field engineers, those are people that are visiting customer sites to, for instance, check or repair an MRI device. They get great AI support now through some tools we have developed where they can now have a natural language conversation with the service manual of a specific device, where they get AI support, for instance, as well to order parts, right, and help with scheduling those kind of things. Those are specific use cases, but they are kind of that new that we are still kind of defining what are the right like success measures or KPIs for something like this. Yeah, so what I want to say is there is a wide range of capabilities and use cases across a variety of different groups of employees, business units, and I think over time we're getting more and more into like measuring progress. As I mentioned, we have a couple of areas such as software development where we have very specific measures in place already, and we already see the benefits of AI. We already see where we need to kind of maybe uh, shift direction slightly, but there are other areas where it's just kind of greenfield and we just started, and KPIs will evolve over time.
Thank you, Jan. That our listeners and most of us always like to hear only about the success stories and the success metrics, but it's also very important to learn from failure. So it would be really interesting to hear from you about a couple of cases where you felt that things didn't go so well or where things failed, and what you learned from that and how you kind of came back from that to do something even better.
Yeah. Look, I give you an example of some tool we have built in-house to
Mm-hmm.
support, for instance, our marketing teams with in terms of approved external communication content.
Okay.
Yeah,
Yeah.
so we are feeding a retrieval augmented generation model with
Mm-hmm.
like external content. Yeah,
Mm-hmm.
so that when, for instance, um, communication specialist gets a request from media with questions, they don't need to start from scratch. They just can leverage this chatbot and get approved kind of responses, which they can tweak, refine, and then leverage. This is something which sounds useful and is useful at the end, but it's
Mm-hmm.
also in a lot of work. Yeah, a lot of work in the sense of making sure the knowledge base of this chatbot, right, is always up to date. So maintenance
Up to date.
is
Mm-hmm.
a challenge, requires manpower and effort. So it's not just like a one-off. I built some cool AI tool and then send it out to the wild and let people use it. A lot of those tools for a lot of use cases require continuous focus, effort, maintenance, and so on.
Okay. Rohit, would you like to ask a question?
Yeah, so Jan, while you do this at such a global scale, um, are you traveling a lot and meeting people in person to motivate them in this direction? Are you using a lot of online tools to make this happen? So what is some of the key tools or methods that you are using to for the advocacy that you're doing
Yeah,
with such a large group of people?
that's a great question. Thank you so much. Look, I mean, when I introduced myself, I should have maybe also mentioned that I focus the most of my time on like uh, our customers, right? Health systems, hospitals,
Okay.
healthcare professionals, and focus
Okay.
with my AI advocacy and AI literacy work really on those populations, like clinicians.
Oh,
Yeah, and
great.
here, right, when I can answer your question from that angle,
Hmm.
um, I travel maybe 80% of my time. Uh,
Wow.
I'll be in
Okay.
the US next week in Seattle and Atlanta, because to me it's so important to meet with those medical experts, clinical experts.
Absolutely. Mm-hmm.
I always can learn from them, right? So I want to understand what are their concerns, what are their fears, what are the issues, what does work, what does not work, and I think this works still, right? Even if we have all those great kind of remote technology, it works best face to face, at least to me. Yeah.
Yes.
But of
Yes.
course, there are also kind of things that can be done online. Just one example, since a couple of years, we are running a AI literacy program for healthcare professionals called Hello AI. Yeah, when you go to helloaiprofessional.com, you will find more information. This is like a self-paced online e-learning type of offering, currently two different modules where
Mm-hmm.
you can educate yourself as a clinician, as a student, as a researcher in healthcare, as an executive in healthcare as well about AI in our particular domain. And this is something where we receive a lot of great feedback over the last couple of years. So far, we have educated more than 5,000 healthcare professionals from more than 70 countries with that program. And we are
Great.
just about to launch later this year a new learning module, which is built dedicated for healthcare executives, right? Health system
Oh,
executives, because this is a population which becomes more and more important in this kind of overall transformation,
mhm.
because what we have seen over the last couple of years is that the healthcare industry, healthcare systems have made progress in adopting AI, piloting AI, but so far only like point solutions. Yeah, so I've implemented some, I don't know, AI decision support tool in radiology, for instance, something else with my EHR and so on and so forth. But those are point solutions. And I think where healthcare executives become more and more important now is to think about AI, plan with AI, and deploy AI in a strategic manner. Yeah, meaning
Right.
how do I do this like holistically from a health system standpoint? How do I measure ROI from a kind of system standpoint? So this is why we thought a separate kind of learning offering for healthcare executives is something relevant, and this is something what's going to launch later this year on the Hello AI platform as well.
That is fantastic. I think definitely there is need for such a thing. And Jan, tell us a little bit more about Hello AI. How did it come into being? Did it precede your um, joining with GE Healthcare, or is it a GE Healthcare initiative? Would love to learn more about this venture. Yeah.
Thank you so much. So look,
Yeah.
first of all, I want to point out that when we think about AI in healthcare, there is very often this kind of initial impression, hey, this is a domain that is led by
Mm-hmm.
either the big tech, yeah, or
Mm-hmm.
by this fantastic, innovative healthcare AI startup ecosystem around the globe. Yeah.
Mm-hmm.
But this
Mm-hmm.
is just partially true. Reality is, especially when you look into AI and machine learning enabled medical devices,
Mm-hmm.
right? For instance, you look to the list of FDA authorizations of machine learning enabled devices, you will
Mm-hmm.
quickly realize that it's a huge play also for the good old medtech. Yeah, so
Mm-hmm.
companies such as GE Healthcare, such as Siemens Healthineers are really leading the pack on that front. Yeah,
Yes.
and this is why, by the way, the FDA so far has authorized more than 1,000 AI machine learning medical devices. Yeah, and
Mm-hmm.
100 of those are coming from G Healthcare. Yeah.
Right.
So I'm saying this because we feel some responsibility as a leader in the field to not
Mm-hmm.
just build those great technologies and integrate them into devices such as this one, and I can talk about this in a second as well,
Mm-hmm.
but also make sure, as I said earlier, right, to do all the important change management and education for those
Mm-hmm.
which we are asking to use those technologies going forward. Yeah, so this is how it started, and what we have done and what Hello AI is, it's really a learning offering that, for healthcare professionals and executives,
Mm-hmm.
um, built by a network of partners. G Healthcare is leading
Okay.
this, but it's
Yes.
a network of partners, different universities, different
Right.
technology companies, to really make sure we spread the word. And our mission at the end really is to making AI literacy accessible and affordable for healthcare
Right.
professionals worldwide. And
That's
Rohit, if I may, one last sentence. What
yeah,
it
please.
is, or we are trying as best as we can to
Mm-hmm.
provide healthcare AI specific education, not just AI education. There's a lot of
Yeah.
AI learning content out there on the web from the big tech, right? For free, no cost, everybody can access. Great. But
Yeah.
we are offering healthcare AI specific education
Yes.
at no or low cost. Yeah, for instance, we have currently two modules in there. The foundational module is free for
Yeah.
everyone, right?
Yeah.
You can go there, you can go through this. And we have a more in-depth module called Professional, 25 hours of content for just $99.
Oh, okay. That's awesome. That's great. And would you be open to licensing this as well? So in case there is any large enterprise interested, Jan, in your offerings, and I'm sure you'd probably look at some licensing deals as well.
So our partnership model, just very briefly, I don't want to spend too much time on
Oh,
this.
please.
We want
Yes.
to talk about healthcare AI, but is like threefold. One is we are looking for partner institutions to join
Mm-hmm.
forces with Hello AI to develop new content. Yeah, AI, as you know, is a fast-paced field. There's a lot of stuff happening. For
Mm-hmm.
instance, earlier today we had a session on federated learning,
Mm-hmm.
which is a new part of the content we are adding to our modules the next couple of days.
Oh,
So Co-development of content is one thing we expect our partners to do with us. Second is, of
Mhm.
course, co-marketing, co-promotion, if you will. And
Mhm.
third, if an institution joins us and helps on those two fronts, we
Mhm.
provide to their employees, to their staff, or to their members, depending on the type of the organization, we provide free access to the Hello AI content.
That's
And
awesome.
so
That's
this
awesome.
is how it works.
Oh, this is great. This is great that you are, offering such a robust platform to increase the awareness and education in this space. So as we come to the end of the podcast, Jan, any other thoughts or sense of direction or predictions in AI that you are seeing lot of agentic AI is coming our way.
Oh,
So
yeah.
any thoughts for the future for the audience?
Yeah,
So,
and I think Jan wanted to show the device, and maybe it's related to, the question that I had was that do you have an example of where AI actually made difference to like patient outcomes? You
yeah.
were able to put it into a device or something that really
Quickly, thank you so much. Yeah.
improved.
Look,
Mm.
maybe just very quickly, Rode, if I can, just a quick use case. From my perspective, a very impactful one. And then I have two, three like takeaways for your
Yeah.
audience. Thank you so much. So first of all, and I showed this to you already on the screen very quickly. This is the ultrasound scanner, right?
Oh,
Handheld, wireless today, right? I mean, for specific use cases, not like for general purpose ultrasound, but for specific use cases. But imagine an emergency doctor carrying this with them wherever they travel. So very powerful tool, very
mm-hmm.
capable imaging modality. But we have one very important limitation with it as well. And this is that it's incredibly operator dependent, meaning that you need to have a certain level of education and an expertise or
To use it.
experience to use it properly and to get to high quality medical images. Yeah, and this is limiting the power of this no radiation, fantastic modality. So what we have done a few years back is we have put AI into those machines. And what it does now is it tells you while you scan the patient, how to move the probe on the patient's body to get to high quality images, which means that even a less experienced clinician can get to high quality ultrasound images as well. Yeah. And
Excellent.
the idea is maybe we can get to a point with further developing this to that allows us to really democratize ultrasound, if you will. So
Mhm.
that's just one example of many, many, right, of where AI is really making an impact in healthcare today. Look to a few things to your audience. First of all, I really strongly recommend everyone listening, right? Be it a tech person, be it a corporate person, be it someone really at the hospital floor. Start rethinking your job description with having AI in mind. Yeah,
Mhm.
I think we all have to do this. We all have to think about, okay, what do I do each and every day? And how
Yeah.
could AI support me? And how does it change the nature of my role of my job? This is one thing. And I think when you start thinking about this, you will start learning about AI. You will open your mind to opportunities and get to the right kind of mindset to embrace this technology. As I said, it's going to come. Yeah, maybe in healthcare it's going to come a bit slower, but it's going to impact all aspects of life, personal but also
Yes.
professional. And therefore,
Mhm.
we should start thinking about this. This is number one. The second thing I just wanted to mention is that we have so many great AI experts, data scientists, software developers around the globe working in this uh, domain of artificial intelligence today. But a lot of them are working in boring industries such as gaming, banking, and so on. And if you know those folks, right, I mean, tell them about healthcare. If
Mhm.
they really want to make an impact, yeah, to society, um, they should consider joining the healthcare industry. Here it's early stage. Yeah, things are slower than elsewhere, yeah, because of the highly regulated nature. But if you have this kind of expertise, this industry would truly appreciate you joining the space because we can really make a difference with this industry. Yeah, and I probably have a couple more things, but maybe I stop here for now. Thank you so much.
No, this
Thank
was,
you, Jan.
yeah, this was awesome,
Mhm.
you know, interaction. So Ritu, yeah, you would like to say anything in closing?
No, just closing that I'm sure the listeners have a lot to absorb and understand, and I think your call to action is really good. I think this is an industry where you can see the maximum impact and really help people. So that was a good call. Thank you.
Thank you so much for having me.